Yeah. Okay, everyone, good evening. I am excited to bring to you another menopause and midlife conversation. And today we're talking about midlife, menopause, and mental health. My name is Noni Banks. I'm the founder and CEO of the Diva Movement and executive director for Flourish and Thrive. And so we created this space, just to be honest, because I needed it, because nobody was talking about it. I had lots of questions. I felt like I was going crazy. And all the friends I was talking to, they said they were going through the same thing. So this really is a space for us to come together, to learn, to get resources and tools to help us through perimenopause and menopause. Before we get started, I do need to let you know that this should not take the place of getting advice from your healthcare professional. This is for educational purposes only. And of course, I will put Dr. Meadows and Suzanne's information in our drop it in the chat, as well as any email communications you get. So if you have questions after this, I highly encourage you to reach out to them. And as we continue the conversation, please feel free to drop your questions in the link, and we will get to all of them. Well, not all. I'll try to get to all of them. But before we get started, I did want our panelists to introduce themselves briefly. So, Dr. Meadows, if you'll go first, and then Suzanne.
Hi, everyone. I'm Dr. Shantae Meadows. I'm the CEO and founder of Meadows Counseling Group. We are a mental health and wellness private practice where we do not only individual counseling, family and couple, but we also help with organizational workplace wellness to help all things mental health.
Perfect. Welcome. Suzanne.
Hi, I'm Suzanne Greiner. I am a nurse. I've been a board certified nurse coach for the last 5 years, but a registered nurse for the last 28 years. And over the last, I would say 5 years, I've been coaching women going through a lot of midlife changes. And then I started going through my own perimenopausal journey at 47 and realized a lot of women are not being educated in this space. And I was dismissed even as being a nurse. And I realized that a lot of women need this education. A lot of women need to learn how to advocate for their health and well-being. And that just put me in this position to really help women to kind of take that step forward to be the directors of their own life, and especially their health care as they go through midlife and as they age. So I see patients across the U.S. And yes, I'm located here in Denver, Colorado.
So thank you both for answering the call and saying yes on this Tuesday evening. I know you could have been doing a lot of things, but you committed to helping women understand this crazy part of our lives. So I want to start by setting the stage. So many women are experiencing changes, but they really don't always understand what's driving them, especially during the season. They're feeling different. Dr. Meadows, what makes midlife a distinct and often challenging season for women when it comes to their mental health?
Midlife is often a lot of life transitionings happening all at one time. And that's one of the things that makes it happen. It's probably at a time in your life, more for a lot of women, it's the first time you actually ever get to slow down. And that's what makes it distinct versus when you're kind of in, maybe your early or late 30s and all the hustle bustle of not only finding your career path, finishing school, possibly being a wife, mother, and having all those roles. But this is the time where it actually, the stage where you really kind of slow down from taking care of everyone else. And because a lot of the hormonal changes, it's like, wait a minute, my sleep is changing, my mood is changing, all the things I'm going through is changing. And so it's like literally a mental shift of midlife is now like, I need to focus on me. I can't, because I don't even have the capacity to keep focusing on all of you. I can't do it. And so that's what makes midlife a little bit different than the other stages of life. It's a lot of transitions, careers, family, friends, like hormones. And so we show up differently in the midlife.
Absolutely. And I hear a lot of women, well, even for myself, I have 4 boys. And so it was go, 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 go. And when we've been an empty nester now for about 3-4 years. And when it first happened, I was like, what do I do? Like, what am I doing?
Transition. So that's a transition in itself, like going from 4 boys, hustle and bustle, I'm sure, of all of their activities and things, to now it's like, wait a minute, there's time in the day that I've never had before. And the mind starts going, that's what I'm saying. There's so many transitions. The mind starts like, what do I do with time? And then you would think, I want to sleep. But then hormones kick in and you like, and I can't sleep.
Yeah. I know.
I got time and I can't do it.
Listen, that's a whole nother story because we're going to talk about that. But thank you, Dr. Meadows. So, Suzanne, from the hormonal perspective, what changes are happening during perimenopause and menopause that women may not fully understand?
Yeah, so a lot of our transitions that we happen at midlife can be hormonal too. So we start to have a decline in our progesterone. That's our first hormone to decline. And that's kind of our calming hormone. That really helps with the GABA receptors in our brain to be nice and calm. It helps us with our sleep. So we start to see a decline in that first. So a lot of times that's when women are getting more anxious than they were before. Sometimes they are a little bit more irritable. They are often like want to go to sleep, or their sleep cycle is just really off more than usual. And they're just having a lot of issues just with that progesterone changing. And then you throw in estrogen. Your brain is actually really rich in estrogen receptors. And so when you start having these fluctuations with estrogen in your brain, you will have, peaks and valleys of your estrogen. You will have your estrogen receptors in your brain will be affected. You'll start having the brain fog. You'll start having some mood changes that's affected with your estrogen too. But just a lot of times women have that brain fog and they're like, what is going on with me? But Dr. Mosconi, she does a lot of research in that area with the brain and perimenopause and menopause. And they're on MRI studies. They will show how estrogen is fluctuating a lot during perimenopause and how it shifts in menopause too. So it really reflects how much our brain is really dependent on these fluctuations with our hormones. So you're not going crazy. You're just like, I just want to reassure you're like, you're not going crazy. And often this time, a lot of women that may have never experienced anxiety or depression, they start to recognize, oh my goodness, I'm having anxiety where I never had it before, or I'm experiencing depression. And a lot of times their relationship starts changing too. So a lot of those midlife changes are happening as well. But then also, if you are currently, taking an antidepressant or anti-anxiety medication prior to perimenopause, you may need to feel like you need to increase your medication during this time frame too. So a lot of women report those changes with just the changes with the hormones happening.
Yeah, wild times.
Yes.
Let's dig a little deeper into how hormones and chronic stress work together to impact our emotional well-being. Dr. Meadows, so how does chronic stress impact women who are balancing careers, caregiving, all the transitions you talked about, aging parents, and other responsibilities?
Well, when stress becomes chronic, the body and the brain are constantly operating in like a full-time, overtime survival mode. And it's interesting because chronic stress also increases anxiety, depression, irritability, sleep disturbances. So it's like you're literally getting it on both ends. And so chronic stress, without even perimenopause and menopause, just the stress alone, how it impacts your mood, your sleep, literally they are the exact same things. And so I would say, even as a mental health professional, that's sometimes for people where we're like teasing it apart to be like, is this stress? Is it hormones? Is it both? And truthfully, it absolutely can be, but it does matter. To Susan's point, like you could have already been on the depressant and the antidepressant, been on an anti-anxiety. And so we know that was already there. And then when you put just stress on it, literally like everything, just what your hormones, and not only your hormones, but literally are your dopamine and your, all the other parts of the brain are really overreacting. And it's also a lot of the things, the heavy burdens that women are often carrying. The body is sending signals all the time that it needs attention. And so that's also that extra feeling emotional, extra anxiety, extra exhaustion. So the stress in itself, without even hitting anything related to perimenopause, really impacts all the same things: your sleep, your mood, your eating. Like literally they impact the exact same thing. So it just makes it very difficult, honestly, during this time for even medical professionals and therapists. This is where like we all have to work together because we are trying to tease apart what came first, the chicken or the egg.
Right. So I do have one follow up. So when should women when should they seek help? So when it goes from what to what should women say, you know what, I probably need to seek professional help. This isn't normal stress. Like, what are the indicators that they would know, okay, I need to get help for this?
Well, I always tell someone, let's try not to wait till it's so bad. So the first thing is, even when you're like, something is off, even with your stress, like if one of the biggest things is to be self-aware, to know I am stressed. That's big, to be able to say, you know what, I'm a little more stressed than normal. That is right then, honestly, I'd say go seek help. And it's more so we can start to help you figure out what are your stress factors. How do you respond to stress? Because we don't all respond to stress the exact same way. Are you getting more headaches? Are you getting more stomach aches? Sometimes those are stress indicators. And so it's helpful if we don't always wait until it gets to that place that it actually has tipped from just stress, and now we're actually talking anxiety and depression. So the real answer is as soon as you recognize it. But I will say for my field, a lot of the things we look at is duration and frequency. And so meaning like, how long have you been feeling this way? Is it just for a couple of days? Is it intermittent? Because that helps me know, is this stress? Stress usually has a short-term life for the most part. There's an end in sight to some of it. But when it starts to hit, oh, you've been stressed for 30 days. I'm going to say that's the duration.
That's not normal.
You've kind of gone over the like, okay, tell me more of now we may be looking at anxiety and depression, and the other parts are so like that. That's why I'm like, if people can start, honestly, when you first start feeling your stress indicators, it doesn't mean you have to go to therapy, but what we can start to do is putting coping skills and strategies to combat the stress to see, because when chronic stress does kick in, after a while, when chronic stress kicks in, sorry, it's no longer chronic stress. It is actually depression and anxiety. Like, we're going to make it this lovely, nice sound that it's chronic stress. But when the body is in that constant survival mode for so long, it is actually experiencing anxiety and depression symptoms. So if we can, as soon as you think you're there, there's nothing wrong with a check-in for us to start strategizing before. Now it's like, okay, it is so bad that even the skills and techniques of coping, we probably now need to start talking possibly medication or other things, where if we maybe have started to help the body and the nervous system calm down before, we can try and combat it a little bit easier.
And that's good practical.
Yeah.
Very good practical advice. And what I hear you saying is listen to your body, pay attention to what it's doing. And for so many years, we were so conditioned not to. And now it's like, okay, we need to really focus on our body. Very, very good information. So Suzanne, what symptoms are often dismissed as just stress or aging that may actually be connected to menopause?
I almost want to say all the symptoms of perimenopause and menopause. I've heard numerous stories, and me included, that, having certain symptoms are like, oh, maybe you're just stressed, or this is just a part of aging. So it's just very dismissive in a way for women, because we know our bodies the best. And like, I love what you said, is like, we have to pay attention to our bodies. We have to really be in tune with our bodies, because our body is always talking to us. And like, I always talk about, like, our body wants to get us into homeostasis. And when it's in that balanced state, and when it's not, it's going to signal to us. And if we ignore those symptoms so many different times, it's just going to add up over time. But like, I think for us, we really have to take ownership of our own body. I always talk about with my clients to become a director of your own health. And so if it's beyond, if you're having these symptoms, don't allow someone to say it's just a part of aging or whatever. Like, really investigate that a little bit more. Stress can do a lot of things physically within your body. So like what Dr. Meadows says, like, you have to indicate, what is it? Is this stress, or is this like hormonal changes? So really have to like take a look at that. One thing I really want to talk about is what I learned a lot about cortisol and the cortisol changes. And when you're in that phase, you don't always want to be in that sympathetic state where you're constantly fight or flight stage or freeze state. You want to get in that normal like rhythm of you have a stressor and then you come out of that stressor. And that's kind of a good, I hate to say balance with cortisol, but you kind of have a little bit of cortisol spike and then you come back to baseline. What happens when women go through perimenopause and menopause is that our body is actually going through a stressor because it's going through this transition. So sometimes our cortisol can be a little bit higher during this transition because our body is changing and shifting. So it's trying to figure out. The other unique thing that happens during this time frame is sometimes our cortisol is kind of like that bossy hormone where it wants to, like, it's a survival hormone. So it has to do, be surviving in that survival state for people. But when your cortisol is at a very high state for such a long time, it actually steals pregnenolone, which makes part of your progesterone, and progesterone is already declining in perimenopause. And so it's stealing that even more. So it makes your progesterone even lower. So it's really important to really look at your stressors in midlife and really, take a look at. And I think a lot of women that I meet with, they're like, oh, like stress management, we hear it all the time, but this is truly the time frame that you really have to take that honest look at yourself and what boundaries do I need to put up to really protect myself and my cortisol and my stressors in my life to really move forward, because it's really, it's a physiological state too that we really have to pay attention to. But yeah, I would say be an advocate for yourself because you know your body the best. And sometimes when you look at things like, no, this is beyond stress, then that's where you have to really advocate for yourself a little bit more.
Absolutely. Thank you for that. Okay, so all this is already difficult, but when you haven't been able to sleep, it's even worse. So let's talk about sleep and the impact it has on us. Okay. Okay. So Dr. Meadows, so what impact does poor sleep have on our mood, anxiety, focus, emotional regulation, and overall mental health?
Everything. It impacts every single thing you just said. It impacts it. I sometimes tell people, think of like if you've had a baby or you've babysat a baby and they haven't had enough sleep. Aren't they very difficult? They fight more. They might even become like biting, and they're all the things. Or I'll say, think about the Snickers commercial and how like a whole different personality comes out. It's not having enough sleep. But in my world, literally, sleep is such an indicator of potential mood disorders. And if you are not getting enough sleep, literally, the lack of sleep can make the brain go into psychotic behaviors. It can, not enough, we do not put enough emphasis on sleep hygiene. And sleep hygiene is literally taking care of yourself. And I work a lot of times often with college students. And I tell college students, hey, sleep hygiene. You can't stay up for 24 hours, party and drink, and think you're going to function. Do that. And then you watch your body crash. Watch a mental health episode. Watch your appetite change. Your mood, sleep is such a regulatory, it regulates our system. We have to get sleep. And that's what makes perimenopause, right, in general, a little difficult because you're not. And that's where I'm like, okay, we talk a lot about sleep hygiene with all my clients around mental health because sometimes it is hard. You can't make a decision. The foggy brain that we're talking about sometimes is literally a lack of sleep. And so that's why it makes symptomatically anxiety. Anxiety is hard because anxiety, sometimes your brain, it just goes, and that can impact your sleep. And then when you're not getting enough sleep, then you can make yourself depressed. Literally, it can impact not only just your hormones, but that we talk about, but the cortisol level. It actually, because not having enough sleep, fight, flight, or freeze is hey, I didn't get enough sleep. It's going off. Sleep is such an important health issue. It is a health issue, and it impacts your mental health and your physical health. But I mean, I really say you can go into anxiety, depression, mania, really based on like not enough sleep. Like I said, psychotic behaviors. Sleep is such an important indicator. And there are people literally, it's based on their sleep conditions, is actually why they have mental health. And once we get their sleep under control, their mental health is under control.
What?
Sleep is such a vital part. And when we're younger, we think we don't need it. And that's why I say when I'm working with my college students and they're out here like, they living it up. And then when they crash, sometimes that crash is a lot harder to come out of because it is literally a health system. It is one of the pathways to total health is actually through our sleep. Wow. And so when peri shows up and menopause shows up and that's a large part why our whole body is dysregulated is because of the insomnia that it can cause. And so with depression, you can sleep too much, or a lot of my clients will say, I can sleep all day and still not feel like I slept enough. Sleep can literally shift and rest. And then there's such thing as what kind of sleep, because sometimes you sleep and then you actually didn't rest. And that's where anxiety pops in. So when I say sleep is probably one of the number one things I speak a lot to my clients about, of all ages. But in midlife, it really sleep hygiene becomes important because we do know how much perimenopause and menopause can knock it off balance. So what's your sleep hygiene? Do you have routines to help you get to sleep? Are you using, that's what sleep hygiene is. What are the routines to stay asleep? If you have some people have a hard time falling asleep. Some people have a hard time falling back asleep. So the sleep hygiene what are your routines when these things are happening?
Wow.
But sleep, all the things you said it can impact, it impacts.
So Dr. Meadows, what I hear you saying, and correct me if I'm wrong, my mental rage, when the rage comes, I should take a nap.
Take a nap. A nap. I say take your snack and look, I have a pastor, he'll say I need my nap and my snack and my nap. Because food and sleep, when you don't have them, you hungry. You think of that little baby who is just fussy and annoyed. You'd be like, I had a baby who didn't sleep. I have twins. One twin did not want to sleep. I have 4 boys also. One of the twins did not. And that's why it's so important for new moms and stuff. When I say sleep is such an indicator, and you're like, take the nap. As we get older, if you can get a nap, get you a nap. Get that nap.
Yeah.
Put it in. Yes. Get you a nap. It will save. Look, it will save everybody. It will save everybody.
You're out here saving lives by telling us to take a nap. Thank you.
That's what you tell a kid. Go lay down somewhere.
Go lay down. That's what we need.
Go lay down.
Go lay down. Wow. I mean, I knew sleep was important, but I didn't realize all that. So thank you for shining a light. And I've never heard sleep hygiene, so I'm definitely going to jump on that one. So thank you. Suzanne, so we know clearly it's a big complaint. So what's going on with our hormones that's making this such a challenge?
For sleep in perimenopause, menopausal years, it's definitely, we have the decrease in progesterone that's happening. And I agree with Dr. Meadows saying sleep is foundational to everything. That is the foundation I speak to a lot of my clients about is sleep is so important. Women actually need 8 to 9 hours of sleep. We need more sleep than men do. And so a lot of women, but a lot of times we're like, I got to do this and this and this before I go to bed. And so sometimes it takes us a while to go to bed, but during perimenopause, our progesterone is declining and that can help us go to sleep. So I remember I could go to sleep and I slept all night long during my start of my perimenopausal phase. But I would wake up feeling like I needed 3 more hours of sleep. So either you can have troubles falling asleep, waking up in the middle of the night, or not having that restful sleep. So there's multiple things, but then there's also multiple things that can kind of keep you sleeping throughout that time frame. So progesterone being low is number 1. Number 2 is maybe you are having your blood sugar crash in the middle of the night and it's waking you up at 3 a.m. and it's all of a sudden when your blood blood sugar crashes, there's a surge of adrenaline. So it wakes you up in the middle of the night, typically around 2 or 3 in the morning, and we feel anxious. So because we have that rush of adrenaline. So is it stress that's waking you up? Or is it that your blood sugar is crashing in the middle of the night? So one thing to do is, like, if you're noticing that more frequently, is maybe making sure that you have a good, healthy protein before you go to bed at night, so that you can sleep through the whole night. And if that doesn't work, then it could be stress too. So a lot of times we're kind of experimenting in perimenopause, what's happening, what's working well for us and what's not. The other thing too is that women are underdiagnosed with sleep apnea, because we don't have the typical neck structure like men do. Men have the kind of the shorter, thicker necks. And so that puts them at a higher risk for sleep apnea. Women, we don't. However, we do have muscle loss that happens during, perimenopausal years. We forget about the muscles that are in our neck that can kind of become more relaxed to make us become more sleep apneic. So if you're still having problems where you're waking up not feeling restful after you maybe start progesterone or something like that, definitely do a sleep study to see if you need to have one. So
nice. Good advice. So before we move on to some more of the stressors and trauma related around this, I want to just let everyone know who's watching. If you have questions, drop it in the chat. Okay, so Dr. Meadows, you specialize in trauma-informed care. How do past experiences or unresolved stress or trauma sometimes show up in midlife?
So during midlife, like I said before, it's the first time we've probably slowed down. And as much as we may not have thought about stuff, there's the saying, the body keeps the score. And so what often happens is during that time that we're slowing down and we're no longer in survival mode, now trauma, childhood trauma, relationship, grief, loss, things that we probably never fully processed are now showing up and back to sleep. Trauma comes back, because trauma has an interesting way of playing in our dreams. And like, there's like it. So nightmares, childhood stuff, things that you probably, and a lot of people will be like, well, I thought I was over that. It's not that first time that you midlife is the first time we've slowed down. You may have become an empty nester. It's the first time that maybe you're not in the hustle and bustle of work, maybe because you're now management. So because I'm now more manager, I'm not day grind. And literally our whole nervous system is for the first time relaxing. And when we relax, we kind of think. And old things that we never fully processed through start to resurface in and on top of that, with the hormone shifts, it's like things that didn't used to irritate us now irritate us. And it's like our brain takes us to, so a lot of trauma is like sometimes thinking about past experiences, trauma that happened in the past. And so when we're now slow and we're not sleeping and we're thinking and we're irritable or we're more anxious, it's taking us to the past events that happen. And so it's actually bringing them more to the surface. And then unfortunately, so our prefrontal cortex, the part of the brain, is where logic exists, and our fight, flight, or freeze is in the back. Well, because of hormone shifts, it's kind of hard to tap into logic because there's so many hormones going. So now we're in full feelings. We're 100, like this midlife is very feeling based. And that's hard for some women who've been grind based in prefrontal and thought, but for the first time, like the feelings are there. Like all the feelings, the good feelings, the bad feelings. You're more weepy than you probably ever have been. I always say it's kind of like if anyone's had a baby, you cry more and you're like, why am I crying? There's no reason to be crying. Some of that is that all that midlife, that slow down is where all the trauma starts to come back up and starts to really like, we become reflective during midlife too. in general, we're a lot more reflective of how life was. So rather if you've lost a parent or your spouse or a partner, you're much more likely to become or have had a divorce. Like all like we reflect a lot more in our midlife because we've lived by the time you got to when you in perimenopause, you got a little bit of age, a little life has happened. And so that's the first time you really like, oh dang man, I wish I would have done this and I wish I would have done that. And not in a regretful way, but in this past way of why didn't I do it? And that's where that trauma of I didn't do it or what didn't happen. And right, if I didn't do this because that happened, all of it just kind of it's the first to midlife is we start to think a lot more and feel a lot more. And it's not all good.
Yeah. Well, let's shift a little bit and thank you for that. And just, just a side note, I've done, coaching for a long time before I stopped because one reason, and most of my clients were middle-aged women, midlife women, and I could not get to the meat and potatoes of what we were supposed to be talking to because there was so much to unpack. And I was like, you know what? I'm not a therapist. I have no desire. This is not my gift. So, it was just, but I've talked to a lot of different people and they've kind of shared that same thing. And that makes sense. Now in midlife, you're slowing down. There's things to think about and so that makes a lot of sense. So thank you for sharing that. So let's shift gears to talk about advocacy and support because we definitely need it. So Suzanne, so many women struggle to know when they should seek medical support. What symptoms should women not ignore?
Well, I think women were really good about knowing what's not happening in our body, but for so many years we've been dismissed. I could go off about like how women's health has been understudied. Women did not participate in some of these studies until 1993. So a lot of medications that are very common in the marketplace were studied on men. So it really like comes down to like, your body the best. And when something feels off, you should have a conversation with your doctor. If I could change the world right now, it'd be like every woman at the age of 35 should have a conversation with, or their PCP should have a conversation with them and saying, hey, you're at 35. In the next, 3 to 5 years, you could start experiencing perimenopause. Here are some symptoms. Let's have a conversation about. Just come back in and we'll have that conversation. Or you're at 35. If you still want to get pregnant, just to let you know, perimenopause will be knocking on your door pretty soon. Just have that conversation with women. A lot of women are not educated about this can happen from 37 to 45 is a good starting range when perimenopause can happen. And a lot of women they don't know that it can be happening. And so I've had several clients that are having babies early 40s and they went from postpartum to perimenopause right away. But if you start feeling like you don't feel like yourself anymore, like there's some shifts that are happening within yourself, that is the time to have a conversation. And please know, if you have a provider that dismisses you, you are not married to that provider. You can find someone else that can listen to you. A lot of times right now, a lot of providers we've had 2 generations of providers not being trained in perimenopause or menopausal care. So a lot of them are still some of them are scurrying to get educated in this area. And some of them are like, nope, I don't need to be educated. So find a provider that actually is going to listen to you. So I wouldn't wait until the floor gives out, because I always talk about how we're living in this 40-year-old house. And so you start noticing the floors are getting squeakier over time. And they get louder and they get louder because you're ignoring them. And then all of a sudden the floor just gives out. Don't wait until the floor gives out, because there are so many things that you can do. Late perimenopause, which is the time frame where women have they start missing their menstrual cycles 1 to 2 months at a time. That is kind of an indication that you're getting closer to menopause. So perimenopause is kind of there's an early and a late stage of perimenopause, and early is just a lot of those sleep and sleep changes and the changes in your irritability and those kind of things. And you may have some shorter, longer cycles. But late perimenopause is when you start losing or missing a cycle, like 1 to 2 months at a time. This is where we have a significant aging event that happens with women in the stage where we have an increase of cardiovascular disease happening. We have an increase in bone loss happening during this time frame. Increased risk of metabolic changes, meaning like you can become type 2 diabetic very easily. Those, like that late perimenopausal stage, is that time frame to really, really pay attention to what's happening. And you can, if you want to, that's a good time where hormone therapy is a great option. You can definitely take it earlier, but talk to your provider about your risk factors and what's best for you and the changes that you're noticing. But definitely by late perimenopause, I suggest it's a good time frame because we start seeing those major changes happening in our health as we start to age. Because once we get past menopause, we are at that higher level of cardiovascular disease. That's the number one killer for women after menopause is cardiovascular disease. It's not breast cancer, it's cardiovascular disease. And those shifts and changes that are happening in perimenopause, we can really be protective of that as we start to age. So
absolutely. Yeah. And so I got diagnosed with heart failure probably 4 years ago. She's gone. 4 years ago, and they're still trying to figure out if it was related to menopause or not. So, here she comes. Here she's back. You're back.
Sorry.
You watched there for a second. But I was just telling Dr. Meadows that I was diagnosed with heart failure 4 years ago, and they're still, trying to figure out if it's menopause, because it's like they put me in the other category because they couldn't figure out the cause. So I totally understand. And I love your analogy about a 40-year-old, well, in my case, a 51-year-old house.
Yeah.
It's creaking. All right.
Yeah. And that's what happened to me is like, I know, even as a nurse, I notice all these variable symptoms. I'm like, either I am getting old quickly, or I have an autoimmune disorder, or something is going on. And then I was in the middle of a meeting and I forgot what I was trying to say to a meeting full of doctors. And I had to dumb down my words because I had a really bad case of brain fog. And that's when my floor gave out. And I was just like, oh my gosh, either I have early dementia or this is perimenopause. And that's where that floor gave out. And I had a lot of warning signs. And that's like, I wasn't listening to my body. And that's where our body is always talking to us and always wanting to give us that information. And whether or not we're listening to it is another question, but really pay attention to what your body's saying to you.
Absolutely. So I see your question. We'll get to it in 1 second. Dr. Meadows, for someone who's feeling overwhelmed, unsupported, they don't know what to do, when it comes to mental health, what are the first steps to getting help?
I think the first steps are being okay that you need and want to talk to someone. I know that sounds very simple, but I think particularly women who are in midlife, we think we should have it together. And we don't reach out always because I shouldn't need to. And believe it or not, that is one of the biggest things I think I'm combating with people is like, I shouldn't need to because life has been good. And this is like, I shouldn't, and I should be strong enough and I should be old enough to know how, like, because that wisdom, we've got wisdom. So we're like, what do you mean? I got to go talk to somebody about it. So we sometimes struggle with that. But I think also just realizing, the same way we have taken care of everyone else, it is really time for us to start taking care of ourselves. So what it is there's the pragmatic parts of knowing your insurance. So there's pragmatic parts, knowing your insurance, of who will they cover and who will they not cover and how often. I always tell people that's the unfortunate part of all of this is it's under the medical field. So I always start with the very pragmatic. Find out from your insurance who will it cover and who it won't. And then from there are so many apps and resources now more than ever. If there's a type of therapist, so if you want a Christian therapist, a LGBT friendly therapist, a Black therapist, like there's lots of ways now to search for therapists. And understand this is not a one size fit all. And so just because one did not feel like it was your mesh, That doesn't mean stop. But the first is realizing it's okay to talk to someone. And no matter how old, like that's, I think sometimes people in the midlife, because we've got age, it's like, well, I shouldn't at this point. This point, I work with a lot of high powered career women, and the number of executives is like, and I'm like, hey, guess what? You can relax. That's because we are so used to and not feeling safe enough. Definitely in midlife, when you've got some clout, we don't always feel safe enough to have that conversation. And so I think it's about understanding it is not a one size fits all. I apologize for if you have a bad first experience, but do not let that be your only experience. And because it really is about finding that good fit of that person you feel that you can be vulnerable with. Unfortunately, one of our barriers to that is healthcare and health insurance, but also talking to someone who maybe can help you find the right resource. A lot of clients we get are from talking to their friends and their family. Oh, this person worked for me. I will say the beauty of things that happen is there's telehealth now. So you don't even have to see someone in your own state. You can see people in other parts of your state, in your own city. There's so many options. The biggest thing is understanding that you don't have to do this alone. There is no weakness in reaching out for help. My no therapist goal is to judge you. As a woman who is in perimenopause, I don't have nothing. I'm right there with you. What you mean? Hot flash, mood. Look, you catch me at the wrong time and I haven't eaten and I'm perimenopause. Look, we're going to be in session and we both going to be looking at each other. We are human. We both going to be, I'm going to be like, sis, you help me, I help you. Like, a therapist's job is really just to help facilitate your process and offer a safe space for you to be comfortable enough to share. And it's also about connecting to the resources. Therapy is just one tool of wellness, meaning like a therapist may say, hey, think about going to see a pelvic floor therapist. I see that libido question in there. A pelvic floor therapist is a therapist that's going to help with that. Meaning some of the conversation is also not only about how you feel, but also helping you think out of the box to help coming up with resources to help you through all of the different challenges. It's really, like I said, it's the first time life gets to be about you in midlife. Allow somebody to be there for you and allow a therapist to be one of those people that can be there. It's about creating your village, and a therapist is a great person to have a part of your village, a part of your healing system. And it's not a judgment. It's not to blame anybody. It is truly to help you get to the best version of you at this season in life.
Love it. Amen to all that. I'm sorry, cut you off.
No, you're good. But that's what to do. There's the logistics, know your insurance, figure out. But even around that, there's a lot of people there's other ways that people try to help. Definitely now that women are talking about perimenopause, there's a lot of us out there trying to be like, okay, this person may not accept your insurance, but I trust, like, that's why I was like, that's what therapy is also about, connecting to helping you build your village, your wellness system. And we, even in my office, we work with a psychiatric nurse practitioner who also is in Paris. So we all try to systematically come. But around therapy, please understand you're not alone. Our job is not here to judge you. There is no weakness in it. And we all, therapists included, any given day, we sitting there in that exact same spot as you. We just at that moment, we're just there to help you facilitate your process. Like, we're here for you. I hope people know that more than anything.
I appreciate it. I appreciate all that you said, especially I've gone through maybe 4 therapists, but you have to find the right fit. It's like dating. You have to figure out who's your person.
And seasons change and life circumstances. I was just telling someone they want to they eventually, I think, need to end with a trauma therapist who really specializes. But even before they get there, I think they need a little bit of a softer therapist to talk about coping skills and strategies, because before you get to the trauma, you kind of want to know that you got some skills to take care of yourself. That's so meaning like you're going to start with this person, and sometimes this first therapist is just going to plant the seed. They're not going to necessarily be the therapist that's going to see the whole tree grow. They're just a part. We have different parts. that we show up for people. And so it's not that it was a bad moment. It was just they were able to, in that season,
like that.
they were good for that. This next one is good for this next season.
That's a good point. Thank you. Thank you. I do want to get to the libido question. So, no one seems, so we have someone that says no one seems to know anything about this in the medical field. I'll let you two kind of answer that.
I'm gonna help a little bit. So one of the things that I will definitely say, so I am a trained sex therapist, and there's a program out there that is called an ASEC therapist. And a trained sex therapist is literally, we're trained in lots of parts of the body. But what is very interesting is I went through a program, and it was a multidisciplinary program. So even when I was trained to be a sex therapist, there was doctors in there, OBGYNs, nurses, pelvic floor therapists. And one of the reason why we're like, you're like, why is there an MD and OBGYNs in this sex therapy certification training? And a part of it is you have to know how to talk about sex in the medical field. I don't care which field, therapist, OB, we don't teach people about how to go to talk about sex. So part of the reason no one in the medical field is talking about it is honestly, unless they have done additional training, the traditional medical model training does not talk about sex. And most of the research is done on males and not females. So even when we talk about sex, the research does not always bring in the complexity, because a woman's body, based on hormones, brain, all kinds of things, is different than, and how women's bodies respond is very different. So even the research is still behind and understanding libido, sex drive, and things of that nature. And that's why there's 200 or plus, there's an infinite number of symptoms to perimenopause. I say that because nobody is the same. And to say, it's an infinite number. We don't know how many, because everybody can experience it. But libido is definitely why no one is able to talk about it. A doctor, if you go into a traditional doctor, they may or may not. They have some information, but the traditional medical model does not teach anybody about sex. And so even as a therapist who specialized in couples for many years, I had to go back for more school to learn how to talk about sex.
Yeah, I agree with that. It's definitely like, I wasn't taught that in nursing school by any means, but libido can be multiple things happening with your body at one time. Like women, a lot of our receptors in our brain are like kind of, that's more of our libido center is like when we have changes and fluctuations in our brain, we can actually have a change in libido. But we also have to look at, like, are you having painful sex? Is your vaginal area dry? Do you need to be on vaginal estrogen? Like those kind of things. It's so like libido, I feel like it says one word, but it can be multiple things that we're looking at. And there's multiple areas of libido. Is it the arousal? Is it the like partnership thing? There's so many things that we have to look into. And I think it's very, it can be complex, but a lot of doctors are not educated in this. And a lot of other providers are not, I don't want to say just doctors, like a lot of nurse practitioners, a lot of people.
No. I had a multidisciplinary, and we came from literally every background of the medical field that you could think of was in my class. Like it, yeah. So
I feel like I was just gonna say, I feel like there's more conversations around it for women in perimenopause and menopause now. There's Dr. Kelly Casperson. She talks a lot about libido and a lot about the changes in perimenopause and menopause that affect sexual health. She's a urologist based in Washington State, but she does a lot of conversations on social media about this. And so, like, if you're treating, she always says, if you're treating the partner with Viagra, how are you going to treat his partner? You can't ignore her because he's going to have Viagra and she's not going to be treated for her libido. So we need to get them back up all on the same page. So I feel like we can have a whole conversation about it. So
there is a book out there. It is not. So I will say, when it comes to women in perimenopause, there's not a book or something that's kind of explicitly related to it. And it's because perimenopause can look different. But we do know symptomatically, because it's really about vaginal health. It just is what it is. That's what it's about. And there's hormones linked to it. So I will definitely say, and even as a sex therapist, so one of the things that we talk about is because libido goes at, truthfully, not just midlife. There's just some people who have low sex drives, high sex drives. There's so many things. And sometimes you experience it around PMS, or, you experienced it earlier. It's just now magnified in our midlife. And so it just looks a little bit differently. So I say that to say general reading and information and just understanding on really understanding vaginal health, body health. So I mentioned a pelvic floor physical therapist. That is literally a physical therapist who does, like, for women, vaginal health. Because going back to even, so it's the complexity, I'm gonna make it all kind of, so trauma. If you've had trauma, it didn't have to be sexual trauma, but even if it was sexual trauma, when I said it comes back up because you, for the first time, but especially for sexual trauma, what happens is our libido starts to remember trauma. And so the first time sex maybe becomes uncomfortable because vaginal dryness, the whole body now shuts down. And so there's just it's not, and that's what makes it a little bit complex. It's kind of like trying to pick up one spaghetti noodle in a big thing. You're not going to pick up one spaghetti noodle. It's connected to so much. And so this is, again, that team. So even working with a mental health therapist, working with a pelvic floor therapist, working with your doctor to figure out, because it's all connected. It might be, we need to do some Kegel exercises. It also may mean, do you need a lubricant? And then be careful. Like there's so many, if you're not on hormone, because hormone replacement isn't for everyone, definitely with certain heart conditions. So it's so complex when it comes to libido. But what I will definitely say is libido very often does fall in the psychological part of it. Because if our mind is anxious, depressed, all of that. So here's a little sex education on this. Our body is a big muscle. For women, the vagina is a muscle. And so I want you to think, when women, we're stressed, we hunch our shoulders, we clench, we're so tight. Well, I want you to think about what else is tight. The vaginal walls. And when we're tight, so like some women clench their teeth and have to have mouth guard. Everything is tight if everything is clenching. Meaning, like, psychologically, that is telling me also there's a lot of anxiety. So you can't ask the vagina to operate the way that it normally would have when all the things, and then when we get mad at ourselves, I see there's frustration, and then we get mad at ourselves. So then again, once we're mad at ourselves, our body it's not going to be nice to us. When you're mad at something, are you not? No. So literally, it's like the vagina at that point is like, well, we're actually when we get in our head, we make it worse. When we literally get in our head, because when we become anxious and we become mad at ourselves, literally your body libido, and what's going to happen is you literally need the mind to send the signal to make the body's lubricant. This is connection. I need the body to actually make the lubricant. Yes, but if I am frustrated and mad, the body is not going to feel aroused. And because arousal isn't happening, extra vaginal dryness. So some vaginal dryness might not actually totally just be hormonal. It may be the psychological indicator that we're not being nice and kind to ourselves. So a lot of libido is related to psychological factors. We tend to find a lot of trauma. We tend to find a lot of anxiety, negative self-talk. This is where we really do have to start taking care of ourselves and be kind, because if we're not telling ourselves the nice things, our body is not going to respond the way we need our body to respond. And that's a part of understanding. And you have to understand the whole cycle of arousal and what happens. And so in this case, this is where you meet with a sex therapist who also helps you understand the different ways in which your body and you and your partner can also, and it doesn't always have to be couples therapy, but just understanding, like, what is your optimal arousal, what you need to do to really have your body respond in the most healthy way that it's going to be comfortable, because our body is hormonally changing, but it's also psychologically changing. And the two meet in the vagina. There's no like that's just simply put. When I teach this class, so I also teach at Ohio State, and I have to tell people, I'm like, okay, I spend the first 5 minutes of class going vagina, 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 just because you kind of got to get, as a sex therapist, I got to rip the Band-Aid off. And so I do this to my students as well. I'm like, but that is even psychological. We laugh. Psychologically, though, it's not something we talk about. We don't talk about the vagina. So even when someone talks about it, we don't even go to our doctor. And there's a lot of women who it's uncomfortable, the dryness or the pain, or even like if you're feeling like, oh, my odor is changing. Yes, because your pH balance is changing. And all those things are not going to make you feel sexy. The mind is connected. If you're not thinking the good things, here's the best way I put it. What goes in comes out. If you're not being kind to your body, you're not putting the good thoughts in, the body is not going to respond the way you need it to respond.
That's true.
Libido is so highly related to a lot of psychological, and not in like, oh, it's bad. It's just all the things that are happening with perimenopause in our body as a woman. And we're like, why isn't it functioning the way we used to it functioning? That actually, we got to give ourselves grace, because that's actually not going to help our libido. It's going to decrease it. But there's a book called it's called Come As You Are.
Oh.
It's a book called Come As You Are. Oh, and if you see the cover of the book, you're really going to be like, whoa. But it is a great sexual health, women's sexual health book. It is an amazing sexual health. It talks hormones. It talks a lot, but it's a hard, but you can pick the section you need. You don't have to read the whole book cover to cover. Pick the section you need. But it is a women's sexual health. It's a really another good book. But yeah, if you see I'm laughing.
Somebody read it, so I need to get on
the cover. You're like, oh, but as you are, and it's a great sexual health. But understanding, no woman, as our body ages and continues to age, give your body grace, give your vagina grace, give your hormones grace, because it's all changing. But if we're not being kind to ourselves, the sexual parts won't operate the way we need the sexual parts to operate, because we're not giving it the right messages. And literally, it is, are you physiologically clenching? Are you telling it nice? Like when I'm talking about your whole body, even we don't talk body shame, but like when you gain the extra weight that perimenopause, are you talking about your body? If you're not talking about your body in the right way, it is literally shaming. And so, once again, I need all the things to help me become aroused. You shaming your body isn't going to help you get aroused. So it's like, it's even learned. So therapy and sex therapy is really about learning how to be kind to your body in all its parts.
Well, thank you for.
I just want to say one more thing before we wrap up in this section, that I know that Nessa mentioned something about like they didn't want to test her hormones. Testosterone also declines at the same time that we're hitting perimenopause. So a lot of times women will have a low testosterone level. So and a lower estrogen level can affect your libido as well. So taking a look at that. But then also another lab is your sex hormone binding globulin. If that is too high, that is making less testosterone available. So those are kind of 3 hormones to really check into if there's physiologically something wrong, with that hormones with your libido. So I just wanted to wrap that up with that. So
I see it says they won't test. I do have a few friends who are OBGYNs. I have a sister-in-law who's an OBGYN, and she was like, everybody is like, comes to the doctor and like, I want to test for hormones. Number one, your insurance is not going to typically pay for a lot of testing. So number one, I need but then also you will do better having a doctor treat your symptoms and not just because if you were looking, they were like, sometimes it's not, because sometimes you will check the hormones and the levels aren't saying what you need the levels to say. And they're like, but then what's wrong? So I have been told from a few different medical professionals, yes, you want these things tested, but more so you want someone who's going to talk to you about your symptoms and what you are experiencing, and not get totally 100% hung up on levels, because sometimes if the levels aren't exactly in the quote range that it medically needs to be, then they can't do. So it's better for them just to treat symptomatically what's going on. Yes, if they test it, but I have heard that has become the number one thing for a lot of doctors lately, is every woman walking in saying, I want my hormones. But even the like the ones that Susan said, they're not on the, unless you ask for those specifically,
right. They're not typical
they're
ones.
not going to test them. Because even your insurance doesn't cover them, because they're not the quote normal panel.
Yeah.
And one of the things my hormone specialist told me is that when they test your hormones, it's like a snapshot of a flowing river. Mm-hmm. So in that 1 second, it could be one thing, and then the next thing. So that's something. I'm not a medical professional, but I sure talk about menopause a whole lot to my provider.
Yeah. And it's just a snapshot in time at that exact moment. So your estrogen will be fluctuating a lot in perimenopause. So it's really hard to you have that data, but it's going to be fluctuating. It could be like really high that time that you are checking your labs and like, oh, you don't need estrogen. But then the next day it could be bottoming out. So it's just a snapshot in time. I like labs because it's just extra, it's data, but also you have to be treated by symptoms. With testosterone, you have to have lab work done to actually take testosterone therapy, just so that it's not too high or out of range or anything like that. But but insurance gets to be kind of funky about a lot of these testing. So if you're okay with paying out of pocket, just know that sometimes this is not always covered. So, but yeah.
Terrible. Well, I want to end with, this was a great conversation. I mean, we could talk for another hour. Okay. Especially about sex. We're going to have to come back and talk about that because I'm intrigued. Okay. I mean, okay. Anyway, so I want to ask both of you this final question. Suzanne, we'll start with you, and then Dr. Meadows, you can round us out. What is one thing you hope every woman takes from tonight's conversation?
I think for us, as women going through perimenopause and menopause, I see a lot of women, we are grasping for information, or we're grasping for just something to help us out along this journey. And we are like in this energy of like, I have to figure out this issue. And it's almost gets to be overwhelming for us. And then we go onto social media and we see all these things and we get so overwhelmed with what's being said out on the social media. I want everyone to like slow down and like listen to your body and what your body truly, truly needs, because everyone's perimenopause and menopause journey is absolutely unique to them. So what worked for your friend may not work for you because this person said this, I need to do this. No, like really sit down, slow down, and really pay attention to what you need during this time frame. And yes, you can do your research. You can definitely do that. But then you have to ask yourself your question, what is my body asking me that it needs in this moment? What kind of support it needs? But then also I feel like a lot of times women, we are going through this identity shift of perimenopause and menopause, and we allow perimenopause and menopause to become our identity all of a sudden, instead of allowing us to be, we're going through this transition. I am going through, I'm menopausal, but I am not like, I'm not perimenopause. Like I want us to separate our identity away from that, because so many people get so wrapped up into that, and that because that identity becomes part of them, they're in that graspy energy. So just really kind of slow down, and what is it that we need to do? What is our body asking us to do? What is it that I can do today? Just a short little thing. What is something simple I can do today? We didn't even get into like lifestyle changes or anything like that, but maybe it's just like going for a walk this evening. Like that's just something to do. Or maybe it's like, I'm going to go to bed earlier tonight, or I'm going to make sure I have a snack before bedtime. What's one simple thing that you can do to nourish your body during this transition and into menopause?
Thank you so much. Dr. Meadows?
I fully second and agree all that. Give yourself permission to ask for help. Mm-hmm. Give yourself permission to slow down and to overall prioritize your wellness. Take this time as a transition as it is a time to be selfish and give yourself that permission that I have lived long enough that I need to focus on me so that I can keep being the best version of me. And it's going to be a new version. And I think that's it. You don't have to earn your rest. So get some rest. You don't have to justify needing help. You don't have to carry this burden alone. Because you're certainly not alone. I would definitely say social media is letting us know all of us is out here struggling every day, just differently. You're not failing, you're not weak. And really, this is the time to be about total health and wellness. And perimenopause doesn't get to define your health and menopause. It doesn't get to define. You literally, at this point, you get to redefine who you are in this stage of life. And that's it. You're not alone. Reach out for help. Get you a village. If you don't, and your village are various people. Some of them are going to be medical providers, some of them not, but meaning because it is helpful to talk to other women that you're not alone in this. And so get you a few of your friends together and y'all commiserate. Girl, what was it like last night? Because even that, believe it or not, helps your mental health. And so meaning don't isolate. Isolation actually does not support mental health in any capacity. It makes it far worse. So that's why I'm like, you're not alone. Tap into a village. Reach out for help. Professional, friends, spiritual, because it is truly total health and wellness. Truly.
Truly. Thank you both. This was a great conversation. I hope everyone enjoyed it as much as I did. So both of you, can you tell everyone where they can reach you? Because for the people who have additional questions, please reach out. They're here to be a resource. Hire them. Like she said, telehealth. I mean, you've heard, for me, I wish I would have had the opportunity to interview or to hear from my providers before. And like so many of you, I've gone through a few before I found my team. But Suzanne, can you tell everyone where they can find you, and then Dr. Meadows?
My website is SuzanneGreiner.coaching.com. So Greiner spelled Greiner coaching.com.
Perfect. Dr. Meadows?
It's Dr. Shantae Meadows, but the website is meadowsllc.com. That's meadowsllc.com. We are also on Facebook, Instagram, and LinkedIn under Meadows Counseling Group. But if you go through our website or any one of those, my team can make sure you get in touch with me if you have additional questions. And we do also, in addition, have therapists. We have coaches and offer in person in the Columbus, Ohio area, as well as telehealth for all of Ohio for therapy, and coaching can be done in any state.
Perfect. So thank you all for joining us today. This is a great conversation, and we plan to have many, many more to help everyone get through this crazy, crazy time. But thank you for joining us, and I hope you all have a great evening. Take care.
Bye.